Hi guys, Doc Marc in here, the dentist. This is the first attempt of creating the new series of Dentinar. This is how I call it, dental webinar. So this is the first episode of the new series that I am trying to create, and I hope it will succeed. But the aim is to present some interesting dental cases to other dental specialists in the form of presentation of photos, documentation, movies, and with talking about it and explaining some procedures in the background of good, in my opinion, music. And this is how we start today with laser apiectomy, which is the case that was done at 35-year-old patient, female patient, who was referred to my office by her dentist, who was proceeding the conservative treatment, and he had a dilemma what to do with teeth number 2. So it is upper left second incisor. So the patient showed me her RFG photo X-ray, which was taken by her dentist, and this is where their dilemma started, because they were not sure if there is an inflammation process visible on this picture, and patient in fact was not complaining about this teeth. Her main complaint was the color, the difference between this teeth and neighboring teeth. She complained about that it was darker than the other teeth. The teeth in fact was not causing any pain. It was a little symptomatic into the percussion test. On the X-ray we can see that there is extruded filling material over the apex, and we can see that maybe in the past there was active process of internal inflammatory resorption, I guess. So we decided to take an CBCT to check out if there is really an inflammatory process, and this is what came out. In fact, CBCT confirmed our suspicions. So this is what we can see on attached picture. On the other view, other angle. So with this examination we came out with a treatment plan. So we told patient that we are going to remove the filling material from the cavity. We are going to remove gutta percha from the root canal. We will try to remove the extruded material through the canal if it will be possible. Then we will re-prepare the root canal. After that we will irrigate it with irrigant solutions. Then we will fill the canal, and after that we will close the cavity. And in case removing of this filling material from outside of the apex will not be possible, then we will proceed in the same session with apiectomy, with endodontic microsurgery, which will let us to remove extruded material and additionally to remove granulation tissue and disinfecting this area. Patient agreed to our proposition. We had to consult it with her doctor of medicine, because she had some problems, general problems with health. So her doctor didn't see any problems, and we could proceed with treatment. So we started with isolation of the operating field with the rubber dam. This is the lingual view, this is the palatal view. We can see the old restoration, which we removed. Then we isolated additionally entire field with the liquid rubber dam, which led us to improve our isolation, which is very important in case when we use laser activated irrigation, because in this case irrigant can flow everywhere, even under the rubber dam. So this perfect isolation is very, very important. Okay, so after that we removed the gutta percha with ultrasonic tip. In fact, it was perio tip, long and thin. I don't remember the exact number of it, but it was perio tip. The removing of it was done with water irrigation, and this is how it looks. As you can see, unfortunately we were not able to remove gutta percha from outside of the apex, so the scenario of doing apiectomy became reality. But we had to finish the root canal treatment first. After removing of gutta percha, we just re-prepared the root canal with, in this case, reciproc R50. Actually, preparation of the canal was not so important in this case, because the root canal was already very wide prepared, as you can see. So we did not want to weaken the teeth additionally. So our preparation was really gentle in this case. We just took our time, a lot of time for irrigation. It was much more important to do the chemical preparation than mechanical preparation. So this is the first time when, in this case, we used laser. It was erbium yak laser, and I will try to show you how it worked. This is the movie that I have recorded on YouTube. Maybe I will try to make it a little larger for you. So as you can see, Oh, now it plays. This is the standard irrigation, when you just use irrigant solution from the needle, and here we use erbium-yak laser to activate this solution. Erbium-yak laser absorbs very good in water and causes that the irrigant liquid fluid goes like everywhere. It goes in every isthmus. It flushes very good every lateral canal. It goes to delta. It goes to apical area perfectly, because it destroys vapor lock. So I think, in my opinion, this activation is the most effective that we can do, and in fact it is the safest one we can use to proceed with our treatment. When we irrigate the solution, we use I think 10 milliliters of sodium hypochlorite and 10 milliliters of EDTA, and both the irrigants were activated with erbium-yak laser. This is called PIPs or sweeps, and this amount of irrigant solution was enough to perfectly clean the inside of the teeth from the debris, to kill the bacteria in superficial layers of dentinal tubules. But it was not possible to disinfect the deep layers of dentinal tubules. This is why in the case of retreatments, I always prefer to disinfect the inside of the teeth with the other laser, with neodymium laser, Nd:YAG, with wavelength of 1064 nanometers. I will present you on the video how it works. Let me just switch to it. And there we go. This is the same case. We can see, we take the fiber of the laser, we get into the canal, we can see and we can hear how it works inside the canal. We do not see the wavelength, but because it is not visible for our eyes, but it penetrates very deeply into the dentinal tubules. In fact, the sodium hypochlorite penetrates, I guess, in about 1/10 of millimeter inside the walls. The light of the neodymium laser penetrates in about 1 millimeter deep into the root canal, so it makes our disinfection much more effective. We can kill much more bacteria if we compare it to just irrigating the solution. And as you will see on the end, this makes our treatment much more effective and the healing much more faster. So after we prepared the canal, after we irrigated it, after we dried the canal, we proceeded with disinfection of the canal with neodymium laser. it was done with 2 sessions, every session about 15 or 20 seconds. I don't remember the used parameters, but I guess it was 1.5 watt, 10 hertz, and 100 microseconds pulse duration. So after that we performed the filling of the root canal, as you can see it here. Whoa, now it's done. So we filled and we obturated the apex with biodentin, and the rest of the canal we obturated with squirt of warm gutta percha and AH plus sealer. After that we filled the chamber with the new filling, with the new restoration, and according to this, that removing of extruded gutta percha was not succeeded, we decided to perform with the other part of treatment, which was supposed to be the surgical part, the endodontic microsurgery. Patient knew about it because we agreed with it on the consultation. So it was all done in one session after we finished the root canal treatment protocol, and after the chamber was closed, we removed the rubber dam, and during the same anesthesia we started the surgical part. So this is the labia view, this is the palatal view, and we started with incision. Incision was performed from the mesial part of teeth number 1-1, and it was proceeded unto the teeth number 2-4. After that we did vertical cut, vertical incision, and in the area of mucosa we just proceeded with semilunar incision directed mesially. After that we opened the flap, it was the full thickness flap, and we were able to see very good all the operated area. The next step in this case was to perform apiectomy, and this part is recorded. I got it recorded on the video, and now I will show it to you. Let me just switch the view, and there we go. I will silence it. Okay, start. So as you can see, we start with removing of the bone over the apex. We do it with erbium-YAG laser, which is 2964 nanometers, and this light was used also for irrigant solution activation, but with different tip. In this case this is a cylindrical tip. We remove the bone, and it is removed because of the ablation. All the tissues in our body consists of water, and the water which is inside this tissue, let's say, explodes, and with this explosion the part of the tissue is removed, and we can very effective proceed with our osteotomy. Effectiveness is not the most important thing here. I think the most important is the safety, because as you can see with laser I am unable to hurt the other tissues, so I cannot hurt the soft tissues, like I could do with the rotary instrument that could break the flap. Or if in case I would use piezo surgery, I would have to be very careful to do not cause the thermal damage of the soft tissues while touching it, or to the hard tissues if I do not irrigate it correctly. The other thing that is very important in this case is that I can see the operating field very good during this process. In fact, my visibility is the best and much better if I compare it to the traditional way. So it is also very important because I can proceed with my entire protocol much faster. So on this picture you can see the performed osteotomy. You can see the operated area. You can see the apex that on the next step we will try to remove, and we will cut it also with erbium laser, but we will change our tip. We will change the cylindrical tip into chisel tip. This chisel tip will cause that our light will be focused and will act like a blade. So see how it works. This is this chisel. Let me just silence it. And now the focus light is much more effective in cutting, so the cutting goes much faster. And I changed it to the I changed the angled handpiece into the straight handpiece because of the visibility, because I wanted to record it. And actually, even if I didn't want to record it, it would be easier to do it with the straight handpiece. But the whole process was going much slower because I was recording while working, so I wanted all this to be visible. So I was always taking care and looking on the screen if everything is visible. In fact, all this apiectomy with laser would take, I think, 30 seconds, but it is a real-time video, so it was not fastened. You can see it in the real time how it goes, but the breaks are because I was looking on the screen if it is visible. I also removed the lateral part of the bone around the apex to make it easier to remove. But as you can see, now I try to remove the apex, but it was not cut till the end, so the part of it breaks, so I had to remove it. But after that I will continue with cutting. So I take my laser again and I start to work. After I cut it, I will try to remove it first with dental applicator of composite, but it will be too difficult. So then I will take I don't know if it's English name, but in Poland we call it Lucas spoon, and it is a very good instrument to remove of the apex. So as you can see, I remove also some parts of the bone around the apex, and I think it is already cut. Maybe in a couple of seconds we will be able to remove it. As you can see, my visibility is still very good when I work. I am not able to break or destroy the soft tissues. And now we take the Lucas spoon. First the applicator. We'll try to remove it, but it will be not possible. So we take the Lucas, and now the removing is possible. And when we remove it, you will be able to notice how much of extruded dental material is inside the cavity, how much of the granulation tissue is in there. And now we will try to remove it with the spoon. And now you can see how, in fact, slow and, let's say, ineffective it is. Because I am trying and this granulation tissue is still stuck in there. So this is why I will, after a couple of seconds, change my tool again into erbium-yak laser. Erbium-yak laser, as you can remember of what I said, absorbs very good in water, so we can choose little softer parameters that will not cause the ablation of hard tissues, but will able us to ablate granulation tissue inside this apiectomy area. And we will do it very fast, very effective, and with good visibility. So you can see I still try to do it. It is not so easy, and again, so let me just fast forward to moment when I started to do it with laser. I think it will be now. Now again the spoon. Oh, yeah, here we go. So again the cylindrical tip, and we go and we clean all the area. We remove all the tissue. Everything is being cleaned until the healthy bone is visible. Okay. So this entire process took about couple of minutes, also with this curettage. So it was not very long, and in fact, because of the previous root canal and filling the apex and the area of the canal with biodentin, which sets in a couple, if I remember good, 12 minutes, we were able to skip the retrograde preparation moment, because we had already fresh, brand new filling of the canal. So entire surgical part took about, I don't know, 15 up to 30 minutes maybe, with all the suturing and so on. This took 7.5 minutes, and okay, I think we see what we had to see. I will just pause it, and let me just switch to the first view so you can see me again. And as you can see, now we had the area of apiectomy. We can see that the apex is removed. We can see the granulation tissue from this area is removed. Extruded material is taken away. Our area is, let's say, ready for deep disinfection. This is the other next step that we are going to do. This deep disinfection we will do with neodymium laser, and it will take 2 sessions of illuminating area with the same 1064 nanometers laser light that penetrates deep inside the tissue and is absorbed also in the tissues, but also in bacteria. And absorbing this light in the cells of bacteria causes apoptosis of their cells. And there is let's say, possibility that bacteria can be here in this area, because we can exceed them during the root canal treatment procedure. The area can be contaminated with saliva during entire surgical protocol, and in fact the bacteria could be there before because they could colonize the extruded material, and that is why the treatment was failed in the first place, this first root canal treatment. So I will show you how to do this deep disinfection with 1064 nanometers laser light. So I will have to switch again to the other view. Okay, I will silence it. So you can see one of the sessions. You can see I will just do it contactless, so I try not to touch the blood inside the operated area. The light penetrates deeply inside the tissues, and the first thing that it is doing is in fact disinfection, but the other thing is biomodulation. The biomodulation is also very important part of this procedure, because it causes entire tissues to heal faster, because it generates ATP. I don't know if you remember it from chemistry, but it is this chemical substance inside the cell that accumulates the energy and then releases it. So this is one of things that this 1064 light causes. And the other thing is anti-inflammatory and anti-analgesic effect. So it is very important for the patient, because it causes them to heal better. After that, we just filled the cavity, as you can see the cavity on different projections, and after that we filled the cavity with PRF, so with this fibrin. I did not use any xenograft to fill the cavity. I did not use any membrane because I thought it is not necessary. And after that we performed with suturing of the operated area. As you can see, we sutured the papillas with vertical mattress sutures, and the vertical incision with simple interrupted sutures, and that's it. It took a couple of minutes. After that, the patient was told what she can do and what she cannot do. We just told her that in the first 2 days she cannot brush her upper front teeth. We told her that she needs to wash very delicate her mouth every 2 hours during the day. We told her that if she needs, she can take some painkillers that she received from us on the prescription, and we told her that she needs to use antibiotic therapy for 4 days. But in fact, we offered her antibiotic therapy only because of her poor general health condition. In fact, if patient was completely healthy, we wouldn't recommend it. So then I would tell patient not to use any antibiotic because it is not necessary, because we disinfected all the area very good with laser light, and it is not, let's say, there is very low possibility for some complications. Patient and the other thing we done on this session was to perform with CBCT. First reason why we did it, because we want to control if everything was done correctly, and second was because we wanted to have some comparison pictures to compare the control CBCT after a couple of months. So as you can see, I did some mistake because I did not cut entirely the root here, but I decided not to reopen the wound because I thought that everything will be fine. So I informed patient about it, and we just left it how it was. Here you can see a different angle, different cut of CBCT. Okay, and patient reported to us for control after 2 days, and this is how it looks after 2 days. And I have a Polish documentation, but as you can see, it is noticed that patient told us that she did not take any painkillers. She didn't need to, because discomfort was very, very low after the surgery. I think the main reason of it is because of the 1064 low level laser therapy, which is called LLLT. We have this handpiece that defocus the light. I think I can show it to you. I have it right here next to me. This is it. And with this here we can provide the light with very low intensity that causes biomodulation, so it fastens up the healing and cause analgesic effect. So this is why patient, this is one of the reasons why patient did not need to use any painkillers. The other reason is because with the erbium YAG laser we did not cause drying of the tissues during all the protocol, and we could do it very fast and in very gentle way. So all this combined together caused this effect, why patient did not need to use any painkillers. Okay, patient reported to us after 7 days after the surgery, after entire treatment, and then we removed the sutures. As you can see here, the papillas here are delicate inflamed. We can see nearly delicate sign of vertical incision. This blood is after the removing of sutures. Patient did not complain to anything. This is the other angle. As we noticed in our documentation, but you will not be able to understand it, she still did not take any painkillers. So after that we told her to report to recall after 3 months. We want to check if everything is good after 3 months. And this is what she did. She came back to us after 3 months, and this is how it looks clinically. As you can see, there is almost no scar, an area of vertical incision. We did not cause any loss of the papillas. We did not cause any recession here in operated area. So I think from the point of view of soft tissues, entire protocol was succeeded. So we decided to take control CBCT, and here is what we can observe. As you can see, the spongeous bone is completely regenerated here in this area, and cortical bone is starting to regenerate. So I think now here you can see different view of CBCT. So this is after 3 months. So in my opinion, this healing was very fast, and this is also because of using of laser. It is because we were able to clean this area with laser assisted irrigation. We were able to disinfect the layers of dentin inside the walls. We were able to disinfect the operated area here, and all this together caused the healing was very fast. So patient was told that she can report to her dentist to proceed with further treatment, with doing the crown on this teeth to solve the aesthetical problem, but also to, let's say, make it more resistant for mechanical failures. So guys, I think we are done for today. I hope you liked what was presented. In case of any questions, here are my contact informations. You can find me on Facebook. You can find me under my nick on YouTube, Dentist Marc. You can find me on Instagram, and in case of any questions, also you can email me. Here is my email address. You take care, have a nice day, and I think in every week I will go with the next episode of this Dentinar. Take care, see ya.